Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are comparing VT versus the SVT with the aberrancy. So first let's look at the VT. So here in VT, the QRS duration. Let's divide them into the following headings. So under QRS duration, it is greater than 0.14 seconds. Next, the fusion beats. So is there presence of the fusion beats? The fusion beat, the answer is yes, fusion beats are present. Next, when you go to the capture beats. So captured beats is again positive. The AV dislocation is again positive. Then independent P waves. So does it have independent P waves? So independent P waves, answer is plus and negative. Next, we look at the Q patterns, the QRS. The QRS pattern. Under the QRS pattern, there is it does not resemble the RBBB. So it does not resemble the RBBB or the LBBB. Now what about the axis? The axis is it has LED, that is the left axis deviation. Then comes the QRS morphology in the V1. So this is monophasic as well as the BP, that is a biphasic. Next is a question on the RS. So what about the RS ratio? The RS ratio in V6, this is going to be less than 1. Then comes a question on the vagal maneuvers. The vagal maneuvers, it has no effect. Now we just spoke about the VT. Now let's move on to the SVT with the aberrancy. So it is a SVT along with the aberrancy. So we'll be looking at them at the same headings. So how is the QRS in terms of the SVT with the aberrancy? So the QRS is going to be about 0.12 to 0.14 seconds, whereas in VT it was greater. So fusion beats is no, negative, and then the capture beat is usually unusual. AV dislocation, this is negative, and the independent P waves is negative. The QRS, if you see the QRS pattern, it resembles that of the RBB. So QRS pattern, it resembles that of the RBB and also the LBBB. Now how is the axis? The axis, it can be normal or it can be towards the right. And talking about the QRS morphology in V1, this will be triphasic, whereas in VT it was monophasic. Here it is going to be triphasic. So how is the RS ratio in the V6? RS ratio was less than 1 in VT. Here it is going to be greater than 1. Vagal maneuvers in VT, it was no effect. Here it will be slowing. So it slows as well as there is presence of the termination. To learn and grow daily like this, please do subscribe.